Hi, everybody. I'm Erin, the owner of Gentle Drafts Newborn Care and Family Services. Tonight, we are here with Maryanne, who is the founder of Healthy Child Concierge. She has been a pediatric nurse for the last 20 years or so, worked with pediatricians. She's also started her company back in 2020 to be able to help give, concierge services to families virtually, but she's narrowed it down to basically working with families who have colicky babies. Thank you, Maryanne, for joining us this evening.
Thank you so much, Erin, for having me.
So tell me a little bit about how you got into, first off, how you got into starting your own business.
Thanks. I've been practicing as a pediatric nurse practitioner in primary care for about 20, 25 years. And I was just really frustrated and unsatisfied in seeing patients for only 10 minutes. And so I'd see them for 10 minutes. They were unsatisfied with only seeing a provider for 10 minutes. And so I decided there had to be a better way. So I did go on and I went and I thought, oh, well, I know I'll get more education. And I received my doctorate, and this still was only seeing patients every 10 minutes. So that didn't change anything. I knew I had to start my own business to really make some change in the world for parents. So I started the Healthy Child Concierge, have had success with helping families with their babies with colic, and love working with these families and giving them some support and answers and hope. And so I have been working specifically with these families and helping them, support them with colic.
I think that's wonderful. As a newborn care specialist and postpartum doula, as I go in there pretty much right after they deliver the baby. And that's where we start to see some of these babies that are showing signs of colic, but it could be a myriad of things that are going on. So tell us a little bit about, I know as we spoke, we'll get more into the colicky babies a little bit later, but as April is Child Abuse Awareness, and we're going to be talking a little bit about that and shaken baby syndrome. Can you tell me a little bit why this month is very, near and dear to you, and why you wanted to do this interview during this month?
Yeah, thanks. So working in primary care, we would see, of course, babies with all sorts of things coming in, but I also worked in the emergency room and in urgent care for several years. And that's when we would have babies come in after maybe they had been shaken and had to be,
Mm.
we've had to look at them and identify them. And so in my experiences working with these families and parents, which the majority of it is unintentional. I know that with April being National Child Abuse Prevention Month, I really wanted to start bringing this forward so that parents know they do get this information in most hospitals, but I don't think parents really know the extent of how they're going to feel, and what exactly it means to how short it can cause problems with the shaken baby. So I wanted to just be able to give more information for parents so they don't have to become one of those statistics that really it is an unintentional injury for the baby.
I'm sure. I mean, I know years ago where obviously when we're younger, our patience is a little thinner than as we probably get a little older, and especially in the industry, or whatever industry that you're in, you understand it a little bit better and stuff. So I know there's a lot of people in their 20s who are either childcare providers or parents themselves who don't have the understanding of what colic is or anything else that really can't stop a baby from, you can't console them basically. And we can get frustrated because we want to, and we want to know how, and we don't know how to communicate well with the babies that I'm sure, as you said, most of them are an accident. It's not intentional for them to get this way, but obviously that's where it got. So tell us a little bit more about how that ties in with you and colicky babies.
So, shaken baby syndrome is the number one form of child abuse, identified child abuse. And what causes shaken baby? The number one cause of shaken baby is frustration with babies crying. So there is a very high correlation with colic, which colic as a diagnosis is only excessive crying. So obviously if you're having excessive crying, you can see that with that frustration with the crying, why it's connected with shaken baby syndrome and with the colic. So that is why we need to address and educate not only about shaken baby, what happens with that, but also what is colic and how can we help with the prevention of shaking baby if you do have a really a crying baby.
Would you say that a lot of possible child abuse does come out of parents and their frustration, regardless if it's colickiness or if it's something else? And if you see that as a pattern, what are some of the things you would guide parents in general to be able to do to relax or calm down?
So definitely, I think that there are patterns of abuse for what our role models might have been negative in the past. If there's cycles of abuse because people don't have the same type of coping, people have these patterns that are ingrained in them that they don't know what tools to go to when they get frustrated, when there is something with their child. Some parents don't know how to discipline their child. They only know what they were shown. And so I think there's a complicated ways of why parents move to child abuse. But absolutely frustration, lack of tools and resources and ideas of what to do when you are frustrated as a parent, and past cycles and what's ingrained in you. So so just for anybody in general, whether you're frustrated and about to pick up your child, there are things that you can do to help yourself feel calm. And so some of the things I do for whether the baby is a colicky baby or, like I said, a parent is just up to here with their toddler and the terrible twos, or they're like kid just is being and pushing those boundaries and being defiant. There are things you can do with some deep breathing. I recommend before picking up your child, before addressing your child, to take those 3 to 4 deep breaths to remind yourself that you are the adult in charge, and to try to get a hold of your own emotions before you touch or address your child. So, taking deep breaths also is our body physiologically responds to lowering our blood pressure, whether we like it or not. So, whether you're anxious about taking a test, whether you are frustrated about dealing with your child, or you're anxious about an interview, taking slow, deep breaths physiologically relaxes our bodies and decreases our blood pressure. So that's an easy, people say take deep breaths. Really, if you can, if it takes, maybe it takes you 10, but if you can take some slow, deep breaths before touching, picking up your child, or addressing your child, that's one thing that I tell parents to do.
That's that's a great thing to do. And I say the same thing to them as well. Or a lot of times, if they're holding the baby, because that's what they choose to do, it can really help the baby learn. Maybe not at newborn stage, they're going to get it, but the more that you follow through and you do it and you take those deep breaths when the baby's kind of crying and you just keep going with them, as time goes on, you are helping them and teaching them how to take those deep breaths when they're, getting upset for whatever reason. It could be just the fact that they're being two, or somebody took their toy, or what it could possibly be. So I think that's great. Breathing is so good. I mean, as you know, you take your first breath when you're focused on it. It's much different than just regular breathing, and it really takes our whole body down and relaxes it.
Absolutely. And you're right. That's a great point about teaching your baby from the time your baby's really young about how to calm down, how to take those deep breaths. I mean, yes, your body relaxes and your baby will feel that energy. So
Yeah.
there's that, even if your baby's not copying the breathing yet. But yes, your toddlers will do that. My children did, even they are 1 and 1.5.
Yep.
They were doing deep breathing with me, and so it's a great practice to have even when they're an infant.
Yes, yes. What are some of the other tools that you could possibly help families? Um,
Right. So I always recommend that they have people to call and talk to. Have a few people that you're just like, if I get too stressed, just even I just need to give you a call. Can I have a list of those people to call? Say preface that with your friends and say, hey, if I get to a point and I just need to talk, can I call you? Can you just take my call? If I have a code word that you can text them and say, I'm calling you now. So I say have a code word is one, and have a few people that you can text. Go outside, bundle up and go outside. Even if your baby or toddler is crying, change of scenery, change of weather, if it's cooler out, change. I mean, that helps us all calm down with that movement of whether we're walking, moving. At the very least, you being outside and the baby is crying or your child is carrying a tantrum, um, it's outside, it's not as loud. So at the very least, it just dissipates a little bit so you can help get to those deep breathing points. Take
You're so
Go
right
ahead.
though about the change of scenery and just there's something about fresh air that just changes our mind and our moods so rapidly that it's great. Whether it's just like, ooh, this is different, for the newborn, and they're like their mind is off of whatever it was before to just smelling the fresh air. I don't know. It's great for us. So that's a
I
great.
think it's a pattern interrupt. I think that with young kids, even, well, not even young kids, even if I'm all upset about something, if I'm in and I'm getting into this cycle in my head, or like a toddler crying or a baby crying, and there's just this continual cycle. I mean, to like interrupt that pattern, and like, all right, let's go for a drive or let's do this. It does can reset things a little bit as well.
Yes.
So it's change of scenery, going outside and moving. I also recommend just putting on earphones with your music, just sticking them on, and just being able to get yourself under control, getting in a shower so that
Yes,
noise is
especially
there.
with a toddler. Um, and toddler, I mean like 1.5 to 2 years.
Yeah,
They can't fully talk to you yet. And they're having big emotions themselves. And if it's a really tense situation between everybody in the house too, it is. It may seem like, at the time you might be feeling like you're ignoring your child, but you're trying to help yourself so you can actually help your child in a healthy
absolutely.
way. And that's what's going to end up being conveyed to the child too, and to yourself, when you can deal with the situation in a more calm, way.
Absolutely. Absolutely. So yeah, so I think that there's a number of the main thing is to, I mean, there's things you can do prevent where you have a planned time, where you have a couple of hours each week where you know somebody's going to give you a break and you know that's coming. So that can be helpful for you to be able to get things, to have that me time. Or, I mean, I used to love just going to the grocery store, and I would walk super slow and enjoy just looking at all of the soaps. I just, when you do have that time alone, even if it is an errand, just take that time to relax and slow down and try to enjoy a little
Yeah.
peace for yourself, and put that into your life with some of the support that friends or family or your partner can offer you.
I love that you said for them to take time out for themselves. I think that's huge. I think we need to spread that word a little bit more and make it normal and okay. Like I tell some of my clients too, especially because I see them so young, that it's really okay for you and your spouse to carve time out while I come, whether it's just even in the house and you know that I'm responsible for the child, or you guys choose to go take a walk, or what it could be, because it's really important for you guys to have that self-care and step away, because at the end of the day it's going to make you a better parent when you come back.
Yeah, and I have a lot of moms and dads tell me that they just feel guilty leaving, if their baby does have colic, for instance,
Yep.
leaving their crying baby with a care provider or even part of their family member. And I just reinforce that people will be okay. It's not 24/7. They can deal with a crying baby for an hour or two. And and people do want to help, and when they realize what you're dealing with, they are able to give you that compassion, and that is a gift that you are allowing them to give you. And it's, so you should allow them without feeling guilty, and knowing that they love you and want to support you. And so to allow that to happen for you, for your baby, and for people to know what it's, to be able to give that gift of support.
I think it's more I mean, maybe just that I do because of what I've done for so many years, but I think it says a lot about the parents when they're like, look, I understand my child is colicky and they're crying all the time. I just need time for myself to be able to mentally get through with whatever's going on. And but I am going to be leaving you with a baby who possibly might not be consolable, but understand, like, I just need to do this to be able to come back. I find that so it's amazing for them to be able to verbalize that. And I find that more people are wanting to help somebody that way too.
Absolutely. Absolutely.
I think that's great. So what are some of the other aspects of child abuse awareness month that you know of? What there's a lot that's going on actually this month just in general, but
Absolutely. Every month. I mean, I don't know if you ever get those calendars or something every day. I mean, it's National Day every day of something.
yeah,
So, but yeah, I think that it's okay to what's near and dear to our hearts. And with child abuse prevention, like I said, in my area, because shaken baby is the number one cause. I mean, there are different types of abuse. Excuse me. There's neglect. There's
yeah,
emotional abuse. There's other, and so regarding overall, generally, I definitely, if you have had that pattern in your past, to make sure that you are having counseling, that you talk through, that you go through, so you can interrupt the patterns for yourself as somebody that has suffered from abuse. So I recommend that for every parent. So like and overall in general, um, and just even to get counseling, especially if you have a high need or high spirited child that needs a lot of attention,
yeah.
that if you do, make sure you're asking for help getting support so you can get breaks. uh, not necessarily that you've ever had abuse in your life, but to get counseling and support so that you can process frustration, you can process going through that. Because like I said, number one cause of the child abuse is shaken baby. I mean, I just want to highlight a few things about shaken baby, which include that it only takes 5 seconds to cause damage. 5 seconds is of shaking. So it's not like you have to shake your baby for a whole minute and a half. I mean, it can happen very quickly.
Yeah.
And 25% of babies die from shaken baby. So in that 5 seconds, a quarter. And then those who don't, almost all of them, 80% have like some kind of symptoms, whether it be partial blindness, seizure disorders, um, intellectual disabilities. So it is, because that's why it's so dear to my heart this month, because it's number one with shaken baby, and I see it with frustration with babies crying. It has such significant sequelae or significant other things that happen from it in such a short amount of time. Why I want to make sure that parents just realize that is something that's very common for the crying can lead to that, and to be able to do those things we talked about for self-care. Do those things if you don't want to take those deep breaths. I do recommend a 10-foot rule, that if you are still frustrated, angry, out of control ourselves, well, not you, but us as parents are,
I
I'm a bit,
understand.
and you, no, but as a parent, if we are not under control and we're still frustrated,
Yep.
um, don't go near that baby that's crying. That's not going to solve anything. So that's, I think, one of the big things with, at least me wanting to give some of that, just wait till you get it under control, and or we get it under control.
Well, right. That is so important to know that, like, it's okay to set your crying baby down in a safe place and you go and calm yourself down, whether that is 5 minutes, 10 minutes, 25 minutes, whatever it is, and the baby's crying, because at the end of the day, if you're not calm, your baby's certainly not going to get calm. So you got to get yourself first, and then you can go and help the baby. I think that's really important to let families know that it's okay to do that.
Right, right.
Um, so I wanted to just touch a little bit more on, I know how you just said shaken baby syndrome is the number one, but you also touched on emotional abuse. Now, I find that it's so hidden, especially for small children. And that's actually the most influential time of their emotions and their confidence and all of that kind of stuff. how do you go about, as a, a nurse practitioner who has worked in with pediatricians, but also in the ER? How do you go about kind of looking at that aspect of abuse?
I mean, of course, in emergency with emotional abuse, we don't necessarily see them in our practices because they aren't brought in. Emotional abuse is under reported because when it may come out is when other children start using that pattern, that being yelling at other kids like they've been yelled at, or calling people names like they've been called, or repeating what they've learned in school settings. It might be happening. And so sometimes counselors or teachers or care providers will pick up on that because it doesn't happen as often in public. So, what emotional abuse is demeaning a child, or it is telling them they're stupid, or they're, just giving them just this negative feedback about everything that they do, and not building their self-worth at all, or taking it away. Again, this is usually related to maybe the parents suffered from this growing up and not knowing, and just this is how you talk to kids because that's how they've always been talked to. And there needs to be, and usually parents that have suffered from this type of abuse do have a lower self-esteem and don't necessarily may not see some of the things they say as a problem. As with anything that we're used to, and anything that maybe not be accessible socially, whether it is, you know, uh, there is like racism, or if it's somebody grows up with it, until it's shown and said to them that that's not okay to talk that way, that or something, or the media or whatever. Um, what I recommend for regarding emotional abuse is if we know people that are doing it to their children, and we hear that, I mean, pointing that out and trying to be like, hey, I heard you say this to them. This is how I felt when I heard it.
Yeah.
And so when maybe we've heard somebody saying that to their child, being careful not to confront. In grocery stores, you might hear people yelling at their kids, demeaning them. There are it's tricky. There are ways with a little bit of humor that sometimes works to move in to be a part of that. Usually, sympathizing is the first place to start. If we see somebody yelling at their kid, calling them names, it is first being, instead of attacking the parent that's using the negative emotional language, it is sympathizing about why do I think that parent is yelling like that,
Yeah.
and then trying to move them in a different place, not to. So that's a public thing. I can't bring them up like, and let's see if we can get you some counseling. Um, but I think there's a way that society can
Right.
intervene to not make it as bad in certain moments. But long term, it is, if you see families that do it often, it is offering support. And also, if it's somebody that's in your family or somebody that having a heart to heart about when you hear that language, how you feel about it.
Yeah.
And so that it's able to open the conversation.
I love that you were saying not to attack the adult in the situation for the way that they're speaking to the child, because you're right. Very often it is the way that they were taught, and they don't know anything different at that, obviously at that point. And so it may not be anything except for that. And they just need somebody to be like, understanding where they're coming from and helping them kind of get through the situation, instead of making the situation worse by being like, why are you calling your child that? Or, that. So
I mean, I think, yeah, I think that just saying, yeah, if you can relate, oh gosh, yeah, when my daughter was
yeah.
2 and was doing that, it was so frustrating to me.
Yep.
And I tried to bring in the little development piece. Gosh, I can't, it's a long time till that part of their brain develops so that they can have impulse control. I mean, I'll try and bring something. Won't it be nice when they have impulse control? Because it's so hard until they're able to. But it is
Yep.
stepping in to stop the language. But like I said, if you do see it longer term, like or in places where you can get them support, whether through school systems or counseling, or counselors at the schools, so that there can be somebody that can step in to help with some
Oh
coordination.
yes, that would definitely be the best solution, obviously, to get them, guiding them into the right direction of getting the support that they need. I was just curious on your side what you would see on that, because I feel like it's starting to come out more and more, the emotional abuse. At least my age, with people having children and they're raising it and they're starting to realize, oh my goodness, this was like emotional abuse, and didn't realize it because that's what they always grew up with and their generations beforehand. And so I feel like it's starting to really come out a little bit more. And we're normalizing that it happens, instead of making people feel badly about it.
Well, and I think that we are doing a better job. We are doing screenings in primary care settings for emotional, where they are, emotionally. So we are doing screenings definitely to catch for younger suicide feelings and feelings of self worth. So we can be able to ask and include younger children, not only waiting until they're adults that might come up with these negative emotions or negative feelings about themselves. There are some types of screenings that not only hit all the way to thoughts of suicide, and that emotional abuse can lead to those feelings sooner, with where kids are with their self-worth, their self-esteem. And maybe so we can identify bullying, whether it's in the home or outside. So some of that is happening in our primary care settings as well, with some of the emotional screenings.
That's awesome. That's wonderful to know too, that they're doing that to try to get it, nip it in the bud, or get them help as early as possible. I think that's great. So thank you so much. Just tell us a little bit about the recap. The 5 steps that you would say to people to be able to help them help them to relax so they don't get so frustrated, or the maybe 5 tips for them to be able to take on how to help their child get through, like, being colicky, or the nonstop crying when they're colicky.
Well, let me tell you a few things about the colic, ways to calm your baby, your fussy baby. I'll do a couple of those, and then I'll recap our 5 for adults. So for calming your baby, most people know about most people know some of the things.
Yes.
They know, like, some people do know about swaddling a baby.
Yep.
And babies, just one thing about swaddling, people might not know, is baby to get into the swaddle. They might be fighting it while you're putting them in, but after you get them in, they settle down in. So they might seem like they're not liking it. So then people don't try it. So swaddling before they're rolling over. So, like between up to 2 to 3 months of age, is something I recommend, is keeping them feeling nice and secure and tight can help with the fussiness and crying. Loud noises such as a shushing sound some people hear, knowing we instinctively do the shh, shh, shh. And
Yep.
that's thought because it mimics the inferior vena cava right behind the uterus. It's where all the blood goes up and rushes up to the heart. And so the babies hear that shh, shh, shh in utero. And so sometimes that also, just like the swaddling, can help them like feel a little bit more secure in their past uterine life. But babies that do have significant colic, having really loud white noise, whether you have a vacuum, whether you have a hair dryer, or you can just get a loud sound machine or app and just have that white noise. And that can also help with the baby with calming them. Jiggling them up and down, or sitting on an exercise ball and bouncing them, not, excessively dramatic where you're shaking their little head, but, bouncing them in a jiggly manner is helpful. I definitely, going outside and changing the scenery for both you and the baby is helpful. And there are, and sucking is where, like, there are the S's where with sucking is involved also. Some babies that are breastfeeding, they might not need to eat, but they might ask to suck a lot. And if they will, take a pacifier. If they're crying too much, they might not. But that can, if they get to a point where they do calm for a minute, that can also help them as well. So those are, some of the things you can do with your crying baby, like for those immediate times, those loud noises. Um, taking a bath with them, that can be for both of you. I mean, if you can have your partner, if you can get into the bathtub, um, and see if the baby will calm down with you in the bathtub. uh, the skin to skin contact is helpful, as well as the warm water for the bath can be helpful for both of you.
Yep.
Now, having a partner there is great, because then if you can't, the partner can maybe walk outside with the baby while you're taking a nice bath, calming down.
There you
And you're
go.
relaxing. So, but anyways, bathing the baby, or bathing each together with the skin on
Yep.
skin, and all those other things for helping to calm the baby temporarily while with your provider, or what's going on. Why is this baby having these bouts of screaming, and like they seem in pain? And then, like we said, for the parent, taking those deep breaths, taking at least 3 to 5 before picking up your baby, and keeping your distance until you're ready. Putting on headphones with music and dancing. There's that movement if you can't walk. I also, which I do include, is I do say, all right, if you put on earphones and just write down why you love being a parent, a few things why you love being a parent, a few things why you love your baby, and just remind yourself, even though they're crying now, you will get through it. There are such more powerful reasons to be able to stay calm, and be there for your baby. Calling somebody in at the very least, which I think that we will include, is calling. There's a national child abuse hotline that you can call. If you don't have, some people are like, I don't have anybody I can call, and they are wonderful people that you can call, and you can also get tech support.
That's wonderful. I love the take a bath, you
Oh, me
know.
too.
I just think that's wonderful because, as we all know, skin to skin really helps babies, and it helps to regulate their nervous system, and get their blood flowing, their heart rate at the right speed and stuff too. So you throw that on with a warm bath, and the parents feeling relaxed, and everybody's relaxed. That sounds like the perfect mix right there. Awesome. So tell us a little bit about how you got into doing I know this is probably a little backtracking, but you do one-on-one virtuals helping people with colic. I am in my position going in right in the beginning. I'm usually one of the first people who sees the baby with the colic, or there's something else going on. So it's not, so as you mentioned, there's really no medical definition for colic. But there's a lot of things that are similar between each baby that kind of goes on too. But so tell us a little bit about how you got into doing that, and what are some of the things that you do see at a very young age.
So, isn't it's just a symptom. Colic is only crying, and there used to be Wessel's rules from the 50s of crying for more than 3 hours a day, more than 3 days a week, for more than 3 weeks. But Rome criteria has taken all that counting of hours away, and okay, basically excessive crying without that, we don't know why. And so there are theories of colic, that, things that cause it. And so there are theories about immature immune system, immature nervous system, immature gut. And so they think that's why babies outgrow it, because their system's all mature, and then they don't have the problems anymore. But I've been working with parents for 20 years, with babies with colic as well, in primary care. And there are some diagnoses that are overlooked. And even though these diagnoses, many babies still might outgrow these diagnoses of a intolerance or an allergy to
Yeah.
a food, or a protein of a food. So you can outgrow allergies, and not all allergies, which is a whole other talk, are IgA related or activated. So we don't have tests for them, but they do have problems. And so, yes, they might outgrow it because they'll get the enzymes to break that down. But there are things that we can do up into the 6 month period that they are. So one I see is food allergies, or some places call it intolerances. Some of them are reflux, and reflux can be because of the sphincter at the top of the stomach isn't tight enough, holding all the food down. But it also can be from swallowing extra air. And that could be related to tongue tie or oral ties. And so there might be a difficult latch, or they might be taking in extra air. So there's definitely things that we can rule out that, which by the way, with oral ties and tongue ties, most kids can outgrow that too without doing anything. But the issue is, are they crying so much and suffering so much during these few months of life that we're just going to guess that they're going to outgrow this or not? I mean, or are there physical therapy things we can do in the meantime? And so there's definite things that I believe are overlooked. So I go through what I do with parents, because I used to just see them for that 10 minutes. And I would say, all right, let's try this formula and see you in a week. And I mean, and that's just so unsatisfying for everybody. And then in a week they come back and I have them for, I guess what, I get the parents for another 10 minutes. And, like I said, most people the babies might outgrow it, but it might be weeks and weeks and weeks or even months. And so what can we do right now? Because another thing with colic is, yes, shaken baby syndrome is definitely highly correlated, but so is maternal depression. So I want to be there for the parents and work with them so that they have the support during these first few months. They're not afraid to have another baby because they're afraid they're going to have another colicky baby, and they get the support they need. So that my goal is to leave no stone unturned. I go through 42 different diagnoses to make sure it's none of these things that we know we can do something about. And then I go into the things we can try. And then I also at least educate about the theories, about what we don't know. And being a researcher, I'm in the literature each week. I looked this week for just year 2021. There are 100 new research articles on colic. 100 in the last 2.5 months. None are earth shattering, but they are bringing on some of that new research. What probiotics we can try. There are 2 probiotics that are showing promise to use because maybe the gut doesn't have that in there when the baby's born. And so we can help with that. So I just think that there's so much that we still can do without, and we don't have the time in our offices, that I wanted to give parents that option to be able to work with somebody, gives that one-on-one, holds their hand, leaves no stone unturned, so that we can get to the bottom of it while they additionally have the support.
I think that's wonderful. I think that there needs to be more of that kind of going on. We need to get back to the old times where you are taking the time to get to know the patient and what is really going on with them, because that's what's really important at the end of the day. We want to help them. So I love that you do that. I appreciate that you have decided to hone in on like the colicky section of newborns. I find so many parents get frustrated with it. And it's wonderful that there's somebody there that is going to take the time, be it 10 minutes, if that's what it takes, or like an hour, if that's what it takes, but being there with them. I think that's awesome. Thank you so much for joining us today. Everybody, this is Maryanne. She is the founder of Healthy Child Concierge, and she's also a VIP member of Gentle Drafts Newborn Care, which is awesome. I love that she's there. She's brought some great information to our Facebook group, and I know she will going forward as well. So thank you so much for joining us, everybody. And if you want to get a hold of Maryanne, you can check out Gentle Drafts, gentledrafts.com/vendor members. Or you can, just check us out at our Facebook group or our Instagram. Awesome. Thank you so much.
Thank you, Erin.